Prostate cancer definition. Prostate cancer is cancer that occurs in the prostate, a small walnut-shaped gland in men that produces seminal fluid that nourishes and transports sperm. Prostate cancer is one of the most common types of cancer in men. Usually, prostate cancer grows slowly and is initially confined to the prostate gland, where it may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. Prostate cancer that's detected early, when it's still confined to the prostate gland, has a better chance of successful treatment. Expanding modes of action of hormonal treatments. As PCA is a largely hormone-driven tumor, understanding the androgen signaling pathway, its role in cell growth, and identification of vulnerable points for manipulation is important when evaluating pharmacological treatments. The centralized hormonal control of T production was the first element of the pathway to be investigated. T secretion is initiated in the hypothalamus with pulsatile release of LHRH, followed by binding to and stimulation of LHRH receptors in the anterior pituitary gland that cause the release of luteinizing and follicle-stimulating hormones. LH stimulates receptors on Leydig cells in the testes to induce production of T suppression of this hypothalamic pituitary gonadal axis is the mechanism by which LHRH agonists, also referred to as gonadotropin release hormone, and antagonists reduce circulation of T levels. Follicle-stimulating hormone and cardiovascular risk. Since older men are at increased risk of cardiovascular disease, it is relevant to evaluate if specific drugs to treat prostate cancer impact this risk. Emerging data implicate a role for follicle-stimulating hormone in promoting the development of factors associated with cardiovascular disease in prostate cancer patients. While the findings require confirmation through further research, it may be of value to assess follicle-stimulating hormone levels during androgen deprivation therapy, particularly if the patient is at higher risk for cardiovascular disease, to monitor adverse events and adjust treatment accordingly. It is critical to identify and manage cardiovascular disease factors in all prostate cancer patients, especially with respect for treatment, hypertension, hyperlipidemia, diabetes, etc. Pros and cons. Pros. Recent data with abiraterone, apalutamide, and enzalutamide seem to confirm the importance of inhibiting the androgen signaling pathway throughout the entire course of advanced disease. These drugs, in combination with androgen deprivation therapy, dramatically inhibit the availability of T to the tumor by near complete inhibition of the androgen signaling pathway. The evidence from prospective randomized trials of LHRH drugs, which typically exclude patients with significant cardiovascular disease, suggests there are no significant differences in cardiovascular disease risk when using LHRH agonists or antagonists. This may be a healthy cohort effect. It is possible to change drugs for scheduling convenience. Cons. The most widely used assay for T determinations is the chemiluminescent immunoassay, which is reliable at the higher levels of T typically measured in men being evaluated for androgen deficiency or infertility, but may be not accurate at the very low levels seen in men on androgen deprivation therapy. In patients with prior cardiovascular events, LHRH agonists may be associated with longer-term cardiovascular risk. T levels should be measured regularly in men receiving androgen deprivation therapy to ensure T suppression is being maintained to the target. This does not appear to be the case in routine clinical practice. Prostate cancer in Ecuador. According to Solca, the standard rate of incidence of prostate cancer in Ecuador is 35.6 per 100,000 inhabitants. During 2017, 4,292 new cancer cases were detected in the matrix, of which 18.3% correspond to the prostate the institution identified. Along with lymphoma, skin cancer, stomach cancer, and leukemia, prostate cancer is among the five most common types of cancer in the country. Conclusions. Patients are living longer and benefit from improved outcomes with the use of new drugs such as abiraterone, enzalutamide, and apalutamide. Monitoring of T is essential to ensure success in achievement of this target. LHRH agonist therapy during the short-term follow-up first 1.5 years, there was an association with higher risk of cardiovascular ischemic events in the architectomy group. The most important behaviors that patients can embark on to improve their cardiovascular health are to eat a healthy diet, exercise regularly, lose weight, and see a physician to manage their medical cardiovascular risk factors, including effective treatment of hypertension, hyperlipidemia, and diabetes.